On-the-scene coverage of ACC.14 is supported by Janssen Pharmaceuticals, Incorporated.
The SYMPLICITY trial is actually very different than the trials that have come before it, both in terms of basic science and clinical trials that have shown that renal denervation actually has a substantial improvement in blood pressure that exceeds what one would do with just medications. It turns out that the medication effect in this trial was one very interesting phenomenon that as you watch the patients and carefully monitor their blood pressures, they seem to respond very well, which means that all resistant hypertension isn't always resistant hypertension, which is something that we've known, and it was very well shown here. The other thing that I find curious about the data is that if you look at the difference between the response of African American patients versus non-African Americans, there actually was a marginally statistically significant difference that actually was similar to the effect of younger patients versus older patients. So this data might suggest that there are subpopulations, such as younger African Americans, who actually would improve blood pressure with renal denervation. But I think the overall trial message is that we need more information, perhaps other devices, and more careful definition of resistant hypertension, because it shows that we really can do much better with careful monitoring.